before I go into my room, I'm going to make sure that I have an order for tracheostomy care for my patient. I'm going to knock on the door. I'm going to gather my supplies before I go into the room. Knock on the door. Hello, Miss Tracy. So walk into the door. I'm performing hand hygiene. I am watching for safety. I'm gonna use the standard precautions and proper body mechanics. And I will identify my patient. Miss Tracy, can I have, I said, yeah, I did say hand hygiene. Can I have your name and date of birth? Tracy here, 1230, 2000. Okay, thank you, Miss Tracy. I will make sure that I have the bed up to a comfortable working position for me. I will put my supplies on a table nearby. I will lower the rail on the side that I'll be working on. Since I'm right-handed, then I will be working on my patient's right side. Okay, Miss Tracy, I'm going to explain the procedure, what's gonna be happening today, how long it's gonna be, and also I'm gonna set up a stop signal with her if she needs me to stop at any time during the procedure. Are you having any pain at this time? No? Okay. If you were having any pain, then I will administer any pain medication ordered, and then I will come back in 30 minutes. So since you don't have any pain, I'm going to be assessing your lungs.
The cotton tip applicator to the tracheostomy, and I'm going to clean the skin around the stomach
for any crackles. And I'm also going to check my patient's pulse oximetry.
From the side of the stomach outward. I'm going to use this only once.
Alright, I'm going to perform hand hygiene. And I'm going to put on a waterproof drape on my patient. Because this procedure is going to have some droplets coming out. So because of that, I'm also going to need a mask and face protector. For the purpose of this video, I'm just going to place it on my forehead, but I will be having it on in real life. I'm going to open my tracheostomy care, always checking the integrity of all my packages and the expiration date. For this procedure, I'm also going to need 2 or more than 2 sterile gloves. And saline, check my normal saline expiration date. Okay, so I will open my tray. And the first thing that I'm going to do is I'm going to remove my drape. Making sure that I don't touch any of the other supplies in the box. I will let it unfold and put the shiny side down. Staying behind the drape, touching only the 1-inch border. And now I will put on my sterile gloves.
So I'm going to pick up the suction here.
If I needed to provide suctioning for my patient, I would do it at this time, but I already did on my other video.
Okay. And then I'm going to, I don't have to worry about that paper anymore. So then I'm going to check the suction foot. So I'm going to put the tube in, put the catheter into my solution.
With the
and then check the suction. Okay? Alright. So after I have checked the suction,
then I'll put on my sterile gloves.
take a deep breath for me. So I'm going to make sure that I'm hyperventilating the patient. And then I'm going to curl it back around my hands and remove her oxygen device with my non-dominant. Okay?
I am only touching the inside of the glove, not the outside of this glove.
I'm going to then, I just made the catheter not sterile, so I would start the procedure all over. I'm going to grab it here. Now I'm going
Blow
to
this out.
pour my sterile.
And now I'm going to grab my
So before that,
package and I'm going to dump it in the middle of my drape. And I'm going to place this right here.
And now I'm going to wash my hands.
I'm going to grab my hydrogen peroxide. And I'm gonna pour that here.
Alright, so once the catheter is a predetermined length, I'm gonna make sure that I'm not occluding the catheter to my point when inserting the catheter, so I don't want to do any suction. So
I will
then
arrange my
I'm
area.
going to, once it's in the predetermined length, apply the suction as I'm occluding my point and I can
This is gonna go in my cleaning container.
just twist it to make sure I get all those.
And I'm going to next I'm going to clean my inner
Okay.
cannula.
And I'm gonna make sure that I'm not
Using this.
suctioning for any
Okay.
more.
Okay, so I just rearranged my area just to have a better flow and also to make sure that I don't cross over any of my sterile area and items. Now I will pour my saline that I already checked the expiration date. I'll make sure that my the label is facing the palm of my hand. I will open it, touching only the lid, and then I will pour it. This is where I'm gonna be rinsing the cannula. Recap it and put it on the side, making sure that I label the time and the date that it was opened with my initials. And now I'm going to make sure that I hyper oxygenate my patient. Ask it to take a few deep breaths. Then I'm gonna remove the mask
Place my patient in a comfortable
and I'm gonna hold down the plate and I'm gonna remove the cannula and put it in my washing
provide good alignment position. I'm gonna lower the bed, put the sirens
container.
off, and
then I will start washing,
place
making
the
sure that I
cola
stay
in
down
reach,
here.
and ask the patient if she needs anything before I leave. So, Miss Craig, do you need anything before I leave? No?
So after I wash it, I'm
thank
gonna
the patient.
rinse it,
Thank you for having me today.
making sure that the water
I'm
all
going to
gets in
remove
there.
This, remove waterproof pad, and I'm gonna remove all
Okay,
my
after I rinse it,
supplies,
I'm gonna put it in my drying container. And just because I already got my gloves dirty with the mucus, I'm going to change them, don new sterile gloves. And I
open the curtain.
also going to, before I do that, I'm going to remove
provide
my
a safety
patient's
check with the patient
gauze and dispose of it.
and documents.
And now I will remove these gloves, perform hand hygiene, and I will don new sterile gloves using the sterile technique. And now I will dry the cannula.
For my final steps, I'm going to remove my gloves, wash hands, place patient in a comfortable position.
Okay. And then I will put this back on my patient. Making sure I give her some oxygen again. And now I'm gonna don new sterile gloves because I'm going to then touch the sterile cleaning. I'm gonna remove these gloves, perform hand hygiene, put on new gloves. Okay. And now I'm going to be cleaning the outside of
For
my
my
patient.
final steps, I'm going to remove
Stoma.
my gloves, wash hands, and place the patient in
by
a
using this
comfortable
sterile
position
water.
with good body
I'm only gonna
alignment.
do one
So I'm
at a
gonna
time.
Lower the bed. And I'm going to lower the bed to the side.
And dispose of it. I would have had receptacle closer to my patient too. Will be more convenient to
I'm
throw.
gonna put the cola in reach.
the trash.
I'm gonna ask the patient.
I'm probably
if she
gonna
needs
need more
anything.
than
At
this,
point,
but for the
do you
purpose
need
of this
anything
video, I'm only
before I
gonna
leave?
use 3 of them.
No?
And then I will
I'm gonna
dry
place the patient.
using
Thank you,
the
Miss
sterile
Chris,
gauze
for having me today. And I'm going to
and using a
remove
new
all the
one every single
supplies,
time you dry.
remove all the supplies, and I'm going to clean the equipment.
And then I will
Open the
then
curtain,
grab
check for
my
safety for the patient and the environment and documents.
cut gauze
Thank you.
and slide it underneath. I'm gonna make sure that I'm not lifting this up. And I'm gonna use a new tie. If I had a second person, then I will have them do the other tie while I do this one. But since I'm by myself, I'm gonna do one at a time. Move it and tie the new slip knot, the new tie one at a time, and reoxygenate my patient. I'm gonna remove the waterproof drape, throw my supplies away in the proper receptacle, remove my gloves, perform hand hygiene. I'll remove my mask also, throw it away in the proper receptacle, and then perform hand hygiene. And now I'm going to reassess my patient, checking the long sounds, checking the pulse oximetry, and then I will also check the respirations for the rate and the force of the respirations. Okay, Miss Tracy, thank you so much for letting me take care of you today. I'm gonna put you down to a control position. I will lower the bed and leave her in a semi-fallish position. Do you need anything from me? Okay, there's water and your call light is within reach also. And then I will, before I go, I will gather all my supplies, remove them, watch for safety. Would you like me to leave the curtain open or closed? Closed? Okay, then I'll leave it closed and do a final safety check. And I'll perform also, before I leave, I will make sure that I clean my patient's mouth if she's unable to do it herself. Okay, and I will leave the room and document and perform hand hygiene after I'm done and document.